Okay, this is going to be a video of the cranial nerve assessment for Kaylin, and we're going to start here now. Okay, all right, Kaylin, so we're going to be testing your cranial nerves. I'm going to start with your olfactory, which is your nose. So what I'm going to have you do is I'm going to have you close your eyes, and then I'm going to put two separate objects in front of you and just tell me what you smell. It should be things that you will recognize, okay? So, okay, cover your right nostril. Okay.
An alcohol swab.
Okay, good. And then now cover your left side, and I'm going to have you smell something else.
Nail polish.
Yeah. Okay, very good. All right, now we're going to test your optic nerve, and we're going to do this by a test called confrontation. So I'm going to have you cover your right eye with your right hand. Very good. And I'm going to cover my left eye. And then tell me whenever you can see my fingers wiggling. Not so much my hand, but my actual fingers wiggling. You ready?
Yes.
Okay.
Yes.
Okay.
Yes.
Okay, good. And then tell me on this side.
Yes.
Okay.
Yes.
Good. One more time.
Yes.
Okay, now switch sides. Cover your left eye. Okay, and I'm going to cover this side. Now again, tell me when you can see my fingers wiggling.
Yes. Yes. Yes.
Good. Again, tell me when you can see them.
Yes. Yes.
Good.
Yes.
Okay, good. Okay, and for this test, I was looking to see the basis that we use for the normal findings is if she can see my fingers wiggling about the same time that I can, and I was able to see that. So now we're going to look at your third, fourth, and sixth cranial nerves. It's going to be your oculomotor, your trochlear, and your abducens. So I'm going to do that. I'm going to move my hands and just kind of follow my finger with your gaze, okay? Okay, look at my finger and just follow the gaze. Good. Okay, and then still follow my finger and hold to the side. Just hold your gaze. Okay, and then on this side. Okay, and there's no nystagmus noted. Very good. Okay. And so now I'm going to do what's called a cover and cover test. And what I'm going to be looking for is eye movement in your opposite eye, and also eye movement in your eye whenever I uncover it. So just look kind of right at me, right over my shoulder, and then I'm going to cover this eye. Good, and there's no movement noted. I'm going to cover this eye. Okay. Good, and there's no movement noted. She's able to keep her gaze on both sides. So now I'm going to look at your fifth cranial nerve, which is your trigeminal nerve, and what I'm going to have you do is clench your teeth really tight. Okay, now kind of bite down on your jaws. Very good. Okay, and then I have an object here. One side is soft and one side is sharp. Let me see, for the purpose of this test, this is sharp, okay, and then this is soft. Okay, so I'm going to have you close your eyes and just tell me if you can feel these areas, okay? Tell me what you feel.
Soft.
Okay.
Sharp.
Good.
Sharp. Soft.
Okay, and then this side.
Sharp.
Okay, sharp.
Soft.
Good. Soft. About here. Okay, and then here.
Soft.
Okay, very good. So now that we're done with this, we're gonna look at your seventh cranial nerve, which is your facial nerve. So I'm gonna ask you to make some goofy facial expressions at me. Smile really big. Okay, and puff your teeth out. Okay, stick your tongue out. Okay, raise your eyebrows. Okay, very good. So all of your movements are symmetrical, and that is a good finding. All of your facial nerves seem to be intact. So now we're going to do what's called the Weber test and the Ryan test. I am going to place this tuning fork on the top of your head. You should feel a vibration. And let me know if you feel it on one side versus the other, or more mid line right down the middle, okay? So just set up straight. And do you feel that on one side or the other, or is it equal on both sides?
Equal on both sides.
Do you want me to do it again? There was a
Yeah,
pause.
I didn't hear it.
Okay.
Equal on both sides.
Equal. Is that side better? Okay. All right. And then now we're going to do the rind test. And tell me whenever I'm going to put it next to your ear. And we're going to be looking for is bone conduction. And tell me whenever you stop hearing the vibration. Ready?
Mm-hmm. Can no longer feel it. I can no longer hear it.
Okay, good. So what we're looking for is about a 1 to 2 conduction. You should be able to hear it at least twice as long.
Okay. Okay.
Okay, good. So now we're going to check your ninth cranial nerve, which is your glossopharyngeal cranial nerve, and also your 10th, which is your vagus. So I'm going to ask you to open up your mouth and say "ah," and I'm going to look for your uvula to go up and down.
Ah.
Okay, very good. And when you did that, your uvula moved up, so that is a good finding. I'm also going to ask that you swallow. Any trouble swallowing at all?
No.
Okay, so we're going to test your gag reflex. This is just a cotton swab, and I'm going to press this against the back of your throat and uvula. And we're looking to see if we can get your gag reflex. Okay, open up. Okay, very good. So now we're going to test your 11th cranial nerve, which is spinal accessory. So I'm going to put my hands here on your shoulders and just ask that you press up against resistance here. Okay, very good. Any trouble with that? They're equal on both sides. Now look your head to the left. Okay, very good. Strong. And then you look your head to the other side. Very good. Okay, you're nice and equal and symmetrical with the shoulder raised against resistance and looking side to side. So that is a good finding with the 11th cranial nerve. Lastly, we're going to test your 12th cranial nerve, which is your hypoglossal. And I'm going to ask you to stick your tongue out at me. Okay, and then move it side to side. Okay, very good. And that concludes the cranial nerve assessment. With the 12th cranial nerve, she had good strength in her tongue. She was able to move it side to side without any difficulty. And there was no drifting of her tongue downward. There was no weakness noted observing it. And that concludes the cranial nerve assessment.